Shane Bishop of Catalyst Healthcare is a pharmacist by trade who one day realized there was an incredible business opportunity in connecting a new breed of pharmacy packaging automation direct to patients. Fueled by his passion for helping people, he set out to build what was a tech startup and is now a business poised for incredible growth. He's here to tell us today about his journey and how Catalyst Healthcare can revolutionize the pharmacy business, and why it's so important to him to make sure people take the correct medications. Welcome, Shane.
Thank you so much for having me.
This is quite a journey, and of course we know each other from doing some business together. Mm-hmm. How does a pharmacist end up transforming the whole delivery of drugs to the patient?
Well, I guess, my story is I had the opportunity to set up the first closed-door, non-retail pharmacy in Western Canada, and to bring in a special type of automation that actually packages medications in a specific format, kind of geared towards, at that time, long-term care facilities. So a more efficient way for pharmacies to package medications, and also safer and more efficient for nurses to provide these medications from these pouches. It was after utilizing this automation and delivering this packaging format to nurses that I came up with this idea. And it was all based around the fact that I was seeing some inefficiencies in the pharmacy, miscommunications between nursing and pharmacy, and nursing still providing at times the wrong medication to the wrong patient, or the wrong medication at the wrong time. Not the nurse's fault, just the system's fault. So I went out and I came up with this concept whereby I approached the vendor of the actual hardware that provided it to my pharmacy, and I said, listen, I would love to be able to have a software platform that basically takes all the information from pharmacy, sends it to your automation. I'm going to tell you what to package, you tell me it has been packaged, and then I'm going to provide that packaging up to a nursing station where a nurse is actually going to scan the barcode on that pouch, and up's going to pop Randy's picture and actually ensure that it is in fact the right medication given to the right patient at the right time.
This is a huge, huge problem in the medical community, and especially with our aging population. So much of the medication that ends up getting prescribed doesn't actually end up with the patient, or they get the wrong medication. Talk to me a little bit about the need for your product.
Yeah, I mean, we started off in the long-term care space, and we were definitely seeing that. We were seeing medication omissions because of the packaging, or the pharmacy themselves didn't package the right medication. All types of areas where, there could be, inefficiencies, or, areas of concern.
Mistakes.
Just mistakes happening, yeah. Right? Manual labor and that sort of thing. It doesn't matter how passionate nurses or pharmacists or the pharmacy technicians are, great workers. At the end of the day, humans are humans. So to really provide a wrapping of technology around what was going on to prevent that sort of thing, we then branched out, where I'm really excited right now, we branched out into the home care market. So we actually came up and integrated our platform, which we've been really great at over the last number of years, into an at-home med dispense device that actually spits out medications for people at home.
Really?
Which is phenomenal, because if I give you an example of what happens at someone, a person living at home. This is a day-to-day event. You go to your pharmacy, you pick up your 9 medications, 90-day supplies of each medication. You bring them home in vials, stick them in your counter, and of course you have to take them 3-4 times a day. Some vials once a day, some vials 4 times a day. It's very confusing, it's very stressful. What inevitably happens is you take the wrong medications, right. You end up back in the hospital, huge cost to the whole system of healthcare. And then you go back to your pharmacy, get different medications, and they end up back in your cupboard. Now you have 20 vials of medications in there, and people get hurt. So number one, we wanted to eliminate that. We wanted to provide something that was 100% accurate, where it just beeped and whistled. You can engage the patient with this. How are you feeling today, Randy? And you can hit the happy face and send that information back to the pharmacy. I have all this information now, right? It really is about driving the health of the patient at home and making sure you take the right medications at the right time.
So you're talking about a device that sits in my home and actually is all programmed and is in actual communication with the pharmacy?
In sync, live, plugs into our platform.
And I just say, give me medication, it spits out exactly what I need, but doesn't give me what I don't need, and it's all figured.
Exactly. Based on our actual platform, we actually provide all that information up to the cloud, down into this little device that sits on your countertop. So you, as a resident in your own home, you don't have to worry about anything. It beeps, it whistles, it flashes, gets louder and louder and louder until such time you come up and you hit the little button, out comes the medication. You don't have to worry about a thing.
So how big of a problem is it for the healthcare industry, let's say in North America, mistaken medications?
Well, if you look at a number that's thrown around all the time in healthcare right now, there's a $300 billion issue right now.
300 billion.
This is that example I gave you with patient on 9 medications. They end up back in the acute care setting because they're not taking their medications correctly. The stats are 50% of patients living at home on 2 or 3 plus medications, which are tens of millions of people, by the way, end up back in an acute care setting because they're just not taking their medications correctly. So it's a major problem. The waste, 90-day supplies, 2 weeks into that cycle, you get a change. Where does it go? Down the toilet, stays in your cabinet, creates more medication interactions and errors and that sort of thing. So it really is about the adherence and keeping people adherent, but we actually provide with our system a short cycle supply of medications. So 1-2 week supply is going to a patient's home, to a long-term care facility. So the waste is eliminated, right? People are more comfortable. The caregivers, think about the caregivers. There's tens of millions of caregivers across North America that look after their mothers or their loved ones' medications and health. It's so stressful for everybody. You actually alleviate that stress by providing this type of technology.
So you started out as a regular pharmacist, right?
Correct.
Tell me your story, because I guess all pharmacists are, I shouldn't say all, but there's definitely entrepreneurial type pharmacists because
For sure.
they open their own stores.
Absolutely.
Drugstores.
Mm-hmm.
Tell us your story about how you end up leading a company, a technology company, and getting out of being a pharmacist. And now actually you've got kind of the worldwide head start on this particular technology. It's amazing.
Yeah, I guess I was fortunate enough when I came out of university. I took my first position as a pharmacist in central BC, and the individual who I worked for was actually the president of a major chain of pharmacies across the province of BC. Owned and operated 5 pharmacies up north. So I really dug in and learned the business of pharmacy, which I love business. It's great. I've learned a lot about business along the way, and any entrepreneur does and is forced to learn about business. So that was very exciting for me. But at the same time, after 2 years up north, I came back to Kelowna and set up my own pharmacy. It's really about patient care. Right? To grow that business, you have to be, first of all, you have to like what you're doing. You have to be very caring to people, and you can actually change the lives of people by looking at their medications, interactions, all the different things that pharmacists do. It's actually very rewarding to see what happens with a patient. I then had the opportunity to explore the technology side, which wasn't just about me one-on-one with a patient in my pharmacy. It was really about healthcare for the masses. How do I prevent these types of errors to everybody in North America? Right? It's now turning into a global opportunity. We have, groups from Australia, New Zealand, Europe coming through Kelowna to our office, looking at what we've put together, which is this ecosystem of care. So I think I'm excited because at the end of the day, this could touch tens of millions of patients and not just the patients that were coming into my pharmacy.
So you saw a need and you decided to do something about it. And the whole medical field, similar, I think, to all major sort of monolithic types of industries,
Right.
Can be a bit slow to adapt to technology just because
Right.
of their sheer size. So you start a little company in Kelowna, British Columbia, Canada, with this intent. Like this is bizarre that you even started. How did you get started? How did you start the process?
Well, I think the big thing.
There's a lot of pharmacists that know about the problem. How is it that you say, okay, I'm going to solve it?
I think at the end of the day, I think you first off, you have to have the courage to jump out and explore your vision, right? So I think that was, one thing, just, my, background is I'm just not going to give up. I had a vision. I found some great people to surround myself with who believed and supported that vision along the way to get us to where we are. So I think that was a big piece of it, but definitely from the business side, just a huge opportunity. Now, I think I've probably been criticized over time for even being too early with the concept, but it's definitely landed now to where we are, right place, right time. Now we're ahead. So these next few years are going to be very exciting for sure.
So your company, it's a private company. What was the biggest challenge for you in getting this off the ground? I'm going to guess that raising capital and keeping up with the development of the company, which is a big challenge for most small startups.
I think so. I think, looking back, I think the vision that, I had and the people that I had around me to make this successful, had we been in the US, maybe we could have raised $20 million to get this thing off the ground and, do it the right way. Being in Canada, and I hear this story all the time from entrepreneurs as well, and you've seen this, is you have to get started. You have to have proof points along the way, so you end up really financing your company along the way, and that creates stress, right? It creates stress. Sometimes you have to cut corners on who you hire, and you can't hire the exact right person for your organization, and is going to help out, but you just can't quite hit the next payroll. And you have to manage your investors along the way as well. So it's definitely been an interesting ride. I think that thankfully, I think we've come through it. I think our investors are in a place now where the ones that have been around for a while are going to see an upside shortly, and the new ones that are in are certainly going to stick around and ride this out. It's going to be a lot of fun.
And you've partnered with some big companies like McKesson, really one of the biggest companies in the whole industry.
Absolutely.
So you've taken this to the next level now. So where are we going to see Catalyst Healthcare in the next year or two? Are these devices actually going to start showing up in people's homes?
Yeah, we spent the last couple of years building out the scalable backbone to allow any pharmacy in North America to plug into what we do, have access to packaging, so that they can provide it to the little devices of the world. Drop in this cartridge and you're off and running. Got all of our FDA approvals and all the different classifications that were required just past September. We launched it here in Western Canada. Absolutely phenomenal, uptake from the individuals and the feedback and tears in people's eyes because of the stress relief. But I see what's going to happen now is we're now talking to the third-party payers, right? These insurance companies that are concerned about that $300 billion and keeping the people at home out of the hospital, because that's where the costs are incurred. How do you do that? You keep people on their medications, you engage with these patients. So pharmacies are starting to adopt across Canada. We've launched it in the US. We have a number of pharmacies with contracts in hand about to sign. So we'll have full coverage across Canada in the next 3 months. Probably every province will be live and up and running with this technology with patients out in the community. US is right behind. We're hitting the bookends, Florida and California right now. But I'm excited about the insurance players and the groups like the McKessons that you alluded to. I mean, Amazon's likely to come into pharmacy. They have Alexa sitting on a countertop that engages you. Right? What's that going to do to healthcare? I think it's going to be great for healthcare, but what is everyone else going to do? We have first to market. We're going to own the countertop space, which is what it's all about. Once you're in there, right, you can help people with their health.
Shane, you already were in business. You obviously owned and operated your own pharmacy, but that's very different from building an international tech company. Tell me about that what you learned and how that transition happened.
Yeah, I mean, I think I knew how to operate pharmacies. We brought, as a company, I brought a bunch of my pharmacy staff over with me into the tech side of the business, into the tech company when we spun out the tech company. For me, we had the domain experience, which was phenomenal. It got us a long ways. But I think the piece that was probably missing for me early on was what makes a tech company tick, right? Product management. How do you translate that into actually software coming out the other side? We fought through it. I had a phenomenal, group of people around me that were hardworking and diligent and believed in it. But I think that was the piece that was missing. So once we were able to understand how you go from a thought to it showing up on your tablet at home, that's when we learned how to scale the business. We were very lucky with the relationships out of the gates. You mentioned McKesson earlier. Obviously they're one of the largest healthcare companies globally. And we've been running alongside with them. We fit into their wheelhouse and the things that they're looking for. So through those types of relationships, we've been able to, penetrate, global markets.
One more question that I'm not sure how I would answer this myself as an entrepreneur. If you knew how challenging it was going to be when you first started, would you still have done it?
I think at the end of the day, I just won't quit. So I would, I have to answer that question. I know I'd still go through it. I've learned a lot. I have the battle scars for sure, without a doubt. Have a lot of great people around me. I've have, some investors maybe that weren't so happy along the way. Do my best, work my hardest, but certainly I always had my sight on what was right, and definitely where we're at is the right thing to do.
Amazing story, Shane, and so proud that you came out of Kelowna, British Columbia, with this what's going to be a huge international company. And I congratulate you, because you're going to make a big difference for patients all over the world. So congratulations. Awesome. And thanks for being on Biz 101.
Thank you, Randy. Appreciate your time.
You
Take
bet.
care.